Hello, everyone. My name is Alon Avidan. I'm a neurologist at UCLA. I'm delighted to be joined here by Dr. Alex Videnovic, a dear friend and a colleague who is a neurologist specializing in movement disorders and sleep medicine. Dr. Videnovic is chief of the Division of Sleep Medicine at the Massachusetts General Hospital. He is associate professor of neurology at the Harvard Medical School and a very prolific investigator and teacher in the field of sleep medicine and neurologic conditions. Welcome, Dr. Videnovic.
Thank you very much, Alon, for this kind introduction. It is so nice to be with you today, and I look forward to our conversation.
Yeah, so a lot of patients are curious about this condition that we share a common research and education interest, REM sleep behavior disorder. So would you please explain what is in the name RBD or REM sleep behavior disorder?
Of course, it is my pleasure. When we say REM sleep behavior disorder, it is really not self-intuitive to explain what does this mean, right? So as I think about this, how to explain this to my patients, I usually start by dissecting the elements and I try to explain what is really in this name, what is in this REM sleep behavior disorder, these four words, sorry. Well, obviously this is a sleep disorder, right? It's in the name. And then in the name, we have this word, the REM sleep. And then there is a behavior that is somehow incorporated in the name of this disorder. So let's start with this REM sleep. As we sleep throughout the night, we usually oscillate between REM and non-REM sleep, which means that this REM sleep is just one of the sleep periods. It's a part of so-called sleep architecture. And very frequently, we dream during this REM sleep. And episodes of REM sleep repeat throughout the night in a cyclical pattern with other segment of sleep, which I said is called non-REM sleep, right? So now we know more about this disorder, right? Now we know about this sleep disorder, which obviously is happening during REM sleep because it is called a REM sleep disorder. But also there is a word behavior within the title of this disorder. And this is because in this condition, patients are exhibiting unusual behaviors, or maybe sometimes even not unusual, but unusual for the state of sleep. And these behaviors can really be very well-formed behaviors, like producing very clear sentences or words. These are called vocal behaviors. Or it can be very well-formed movements, like kicking or thrashing, or even falling out of bed. Sometimes these behaviors are not very well formed, and they may be some mumbling noises or sounds, or very minor stereotypical movements that patients can make during this REM sleep. So this is really what is in the name, right? REM sleep behavior disorder. Patients are having behaviors as they are asleep and as they are going through the stage of sleep, which we call REM sleep. Important component and how usually patients tend to describe this disorder and symptoms when they come to us is they will say, I have a really bad nightmares. My wife tells me that I act out my dreams. I am frequently being attacked in my dreams. And a very important descriptor of this disorder is that patients have really dreams that are frequently filled with the negative emotional content, negative emotions. These are very action-packed dreams very frequently. Patients are patients feel threatened, being attacked in many cases. And the result of this dream content, they exhibit a behavior and they try to move or trash or kick or yell, they basically act out their dreams. And as a result of acting out their dreams, they certainly can hurt themselves, can hurt their bed partners, can fall out of bed as they imagine that they are, for example, jumping in a swimming pool in their dream or something along these lines. So this is what I would say are main descriptors of this REM sleep behavior disorder.
That's very helpful, Dr. Videnovic. As a follow-up question, perhaps I can ask you, if a patient is concerned that they may have a REM sleep behavior disorder, and they ask you, well, how do I know that this is the condition and this is not a nightmare or a sleep terror episode? What are the clues that this is more than just a simple nightmare episode?
Well, I think that usually these events will happen in the stage called REM sleep, which increases in duration and frequency in the second half of the night. So very frequently we will hear from patients and their bed partners that these behaviors emanate after midnight, or certainly as the dawn is approaching, that the intensity and frequency of these behaviors may increase. Patients will usually have a reasonably good recollection of their dream, but that certainly may not be the case. I would say that these were probably among major distinguishers or major features that distinguish this disorder from other disorders that belong to a group of sleep disorders called parasomnias.
That's very helpful. Thank you so much, Dr. Videnovic, for joining us and being such a good educational resource. So we really appreciate this. Thank you again.
Thank you.